Hello, welcome. We have today another session of digital slide review and sign out. I'm Dr. Lewis Hassel, coming to you from the campus of the University of Oklahoma Health Sciences Center in Oklahoma City. Our cases are courtesy of the Digital Anatomic Pathology Academy, which is a joint venture of Digital Pathology Association and Path Presenter. We are grateful for their support. Our case comes from the realm of GI pathology. This is a 50-year-old man who has a 2-centimeter mural mass located beneath the mucosa, no mucosal lesion, and the endoscopist thought that this most likely was going to be a small GI stromal tumor because of the location, the patient's age, and presentation. However, after performing an endoscopic excision and getting this material out, we have different news for him. So here we see multiple fragments. We see some calcification. We see there's a moderate amount of cellularity, and we see here some relatively normal appearing gastrointestinal gastric mucosa. It looks like it's from the body. But look at this tissue here next to it. This is definitely not body tissue, but as we look at this, we see that there's a lot of these sort of granular eosinophilic deposits. Many of them have seemingly sort of some surrounding or subtending cells, and we see there are a few giant cells here as well. So this is, rather than being a carcinoma or much less a GI stromal tumor, something that's characterized by a very abundant and exuberant foreign body giant cell reaction to this granular and in areas very eosinophilic and somewhat lamellated. You can see there's little bits of lamellar ring-like structures to some of these here with different levels. We'll take a look at some of the other fragments as well to give you a feel for the spectrum of problems that are here. Here we see some calcific debris, and here's a little bit of gastric epithelium, more of this eosinophilic, somewhat serpiginous type debris. And then more of this more hyalinized eosinophilic material. And again, still abundant foreign body type reaction to this material. So one could certainly just say foreign body granuloma. However, the very granular seed-like or grain-like character of this tissue with the lamellations and the foreign body giant cells is characteristic of what's known as the pulse granuloma. So pulse granulomas refers to the seed products of legume vegetables, so the beans, lentils, and so forth. And these are sometimes bulky foreign body type granulomata that is characteristic, and it's located outside of the lumen or deep to the mucosa. It's not actually within the surface. In some descriptions, these are described as hyaline rings or grain-like eosinophilic substance that has multinucleate cells admixed, usually encasing, but sometimes even within the middle. Now, clinically, these are fairly common in a pediatric patient age group in the oral cavity, or in some adult populations where they are edentulous or have lost their teeth. But they have been reported to occur pretty much everywhere in the entire tubular tract, and even rare cases in the gallbladder, although usually those are associated with some sort of a fistula formation. So here's another example, this one from the colon and for the pericolic fat, typically associated in those circumstances with a diverticulum. Now here we can see that there's actually some food particle associated with it, some plant material here. And here we see this very serpiginous ring-like or wandering eosinophilic hyaline material again with a characteristic multinucleate giant cell response. They've also been reported to occur in the lungs, and I don't believe this is from the lung. I think it's from soft tissue. But in those cases, sometimes it's been called lentil pneumonia because of the airspace filling characteristic of this process. And of course, in that circumstance, one could surmise that it's due to aspiration. The differential diagnosis for a pulse granuloma can include foreign body reaction secondary to other items. And we've recently seen described and seen in our own laboratory a similar sort of process secondary to the ORISE lifting agent that is used in endoscopic mucosal surgery in some locations. Amyloidosis might occasionally give you this sort of hyaline eosinophilic material. Lysogang rings also have been reported to have a similar appearance. And of course, Crohn's disease with fissuring ulceration can lead to extravasation of food and enteric contents and formation of granulomata. Here's a nice low power image of our ORISE granuloma, this occurring in the esophagus after a endoscopic mucosal resection for Barrett's esophagus with dysplasia. And you can see this somewhat similar appearance of a seed-like or granular, nodular type eosinophilic material with some associated foreign body reaction and this again occurring deep to the mucosa. So that's our brief case today, a little pearl. Final sign-out diagnosis is pulse granuloma involving the gastric wall and not a GI stromal tumor. We hope you've enjoyed that case and that you'll subscribe and offer your comments, share this, like it, all of those good things that indicate that we should keep going. And we'll hope to see you again soon as we post more content on our channel. Thanks for joining us, and until then, good day.